ladies. Today we are discussing, does a diagnosis even matter? I'm Jenn Lormand, exercise physiologist.
I'm Christina Walsh, licensed physical therapist. This can be a really tricky thing to navigate for the women who work with us. It's, do I need a diagnosis to get better? Then if I get one, what do I do with it? It can be super overwhelming when you're facing these really personal and intimate issues to know where to turn next.
Yeah, many women really feel like they need that diagnosis because to them, it feels like they can get their hands around it. And we say, if you fall in that camp, please go get a referral to urogynecologist. They would be the ones who could diagnose your pee, your poop problems, your pressure problems.
Absolutely. Or if you're having the back and hip stuff, see an orthopedist. Go see the expert in the area of the issues that you're having in the Western medical system if you feel compelled to do that, if you feel like it would help you get your hands around what's going on in your body. However, lots of women dealing with this stuff, when we start to use the diagnostic terminology or start to mention this sort of thing of getting a diagnosis, they clamp down in fear because the last thing they want is to associate themselves with those formal diagnoses. They feel like it's fating them to a future they don't want to be tied to. They're overwhelmed, they're intimidated, they're terrified. If that's you, don't go get the diagnosis, because the truth is, either way, you can find the same help and the same help will work for you. And that is proven by the 3 years of research that we did on the protocol that we tested on ourselves first and then on lots of other willing guinea pigs.
Yeah, it's part of the reason why we're on such a big mission. And if you go to our website, you'll see the opening block is the women's healthcare system is failing us. And we say that because whatever camp you fall into, whether you've had a diagnosis of prolapse or some other specific bladder or bowel condition, oftentimes you get pushed down a certain route of treatment, be it pills, injections, surgery, other invasive treatments that many of the women we work with have tried, and they've had a resurgence of symptoms, or they simply don't want to go down that path and don't know that there are other options available to them.
And that is why we do what we do. We've found another way, and we want to make it accessible to all the women who can benefit from it. And it doesn't matter whether you have a term for the discomforts and the issues you're battling with, or you don't have a term. Yeah. And it can be really hard.
You know your body.
Yes,
you
absolutely.
Intuitively know if something is wrong with your body. So if someone else you're reaching out for help and someone is denying that or saying this isn't a big deal or this is common, we would love for you to continue to persist to find someone who will listen to you, because yes, many of these issues are common, but they are not normal.
They don't have to be your new normal. That's for sure. You could even argue that they've become normalized. They become normalized.
Yes.
The jokes about sneezing and coughing and laughing and peeing are just everywhere. But you don't have to end up in adult diapers if you don't want to. It's surprisingly easy to address this stuff conservatively without surgery or anything invasive. But whether or not you want the term or whether you don't, whether you have it, whether you don't have it, you can still be helped by the same things. And we don't want to see women pigeonholed by that either. Some women come to us, they've got the diagnosis and they go, okay, I didn't see this one exact word on your website. So even though I have all these things going on, I'm not sure, is this for me still? Or they see one of the diagnostic words on our website and they go, well, I see you mentioned this, but I don't have that. So I'm not sure if this is really for me.
Yes.
Either way, it is for you. And that's why we do make it a point to list some of the medical terminology, but also list it in how it feels in your body, in your life on our website, and the way we talk about it here with you. We want to dignify you with sharing that medical terminology with you, but we don't want to confuse. And we understand that journey can be so overwhelming. It's incredibly emotional to deal with any of these issues.
Yes.
Another thing is the women who end up at the orthopedist for the back and hip stuff, and they say, okay, but they get their x-rays and
they're fine.
Nothing's wrong. Okay, so on the one hand, you can jump for joy. You don't have a blown disc, right. There's no terrible arthritis in your spine, but that leaves you kind of dumped by the system. Like, now what? And the answer is, by connecting the dots and treating the whole pelvic core musculoskeletal system, you can address and resolve all of this stuff.
Yep. And on our website, We have a quiz that you can take if you've been dealing with women's health issues, some pee problems, some poop problems, some pressure problems, or back and hip tightness. It is a great tool to be able to connect all the dots for you to really understand how these things are all related.
Yes, the 5-minute quiz. It's on our website, linked in our Instagram bio, and it is incredibly eye-opening. Light bulbs will be going off in just that 5 minutes for you going, wow, I had no idea all this stuff was connected. And the good news about that is it can all be fixed all at once.
So if you are stuck in this space, maybe you're on the border, you resonate with some of the symptoms that we talk about or the issues that we talk about, you're not sure if you want a diagnosis, whatever the case may be, feel free to reach out to us. hello@tightenyourtinkler.com. We love getting your messages and we would be happy to direct you in the right place.